Help, my YouTube channel is under attack now over the past couple of weeks, and thankfully, they've both been overturned. But whenever I decide to talk about these types of issues, and especially invoking, the evil term ivermectin, oh my gosh, a couple of those videos ended up getting hit by YouTube and temporarily taken down. It's like, you're dispelling medical misinformation. It's like, no, I'm not really. Okay, we were talking about one specifically. I even forget what one of them was about, and that one was a few weeks ago, but the one that was most recent, it was about ivermectin and then how it correlates to fighting cancer. So it's like, what does that have to do with the coof? It doesn't really make all that sense. So I just figured, hey man, now that the Eye of Sauron is currently fixed on the channel, why not just double down on all this stuff? Because I'm not a guy to back down. You know about that from the main channel. So, hey man, we are here right now, and we got a two-parter today and tomorrow, okay? Because Epoch Times did us all a solid, and one of the most popular videos, well, actually far and away the most popular video that's on this channel, is all about those weird fibrous growths that people are finding inside of, people that just, magically drop dead. I don't know why or anything like that, but no, they're deciding to kind of delve a little bit deeper into this stuff. So why spike protein causes abnormal foot-long blood clots, 200 symptoms. Yeah, who knows? So today and tomorrow, we're going to be looking specifically at this. Well, they have it as a two-part paper, and I'm going to have it as subsequent videos for Monday and for Tuesday out here. So I want to double down on this stuff because mostly you probably know somebody who will ultimately be affected. I probably know somebody who's ultimately affected, and if we're going to be able to hold anybody accountable, we should know the information that's out there. So I'm trying to talk in a little bit of code that's out there, but and I know exactly what we're talking about. So without further ado, since mid-2021, unusual lengthy blood clots were found in vessels of COVID-19 patients, and jab recipients have been reported across the world. We as embalmers are seeing some strange clots since the COVID outbreak. These clots are very rubbery feeling, gross, and very long as they exit the veins, and we use during the embalming procedure. They really appear to be like earthworms. I have never seen this in my career until now. Larry Mills, a licensed embalmer and funeral director in the state of Alabama, told the Epoch Times. Yeah, and if you want more of that specifically, that's the video that's on the channel. And likely, if you're watching this one, you probably watched the previous video as well. So let's take a look at the symptoms specifically. Doctors have realized since the early days of the pandemic that the coof is not just a lung disease, but also an endothelial and vascular disease. Physicians have summarized a list of unusual clinical observations of the coof, including, but not limited to, severely hypoxic. Low oxygen patients despite relatively normal lung compliance. Upon examination, thrombotic complications and consistent autopsy findings of blood clots, thrombi, in the microcirculation of the lung. After an acute COVID-19 infection, over 200 different lingering symptoms have been reported of long COVID, which can persist for about 6 to 24 months. Interesting. Okay, the most frequent symptoms include breathlessness, fatigue, brain fog, cognitive dysfunction, muscle aches and pains, myalgia, sleeping difficulties, and anxiety and depression. The chronic relapsing nature of long COVID is mainly caused by immune dysregulation, hyperinflammation, oxidative stress, and mitochondrial dysfunction. But how could that be, and why? Clues have emerged since 2020. In November of 2020, a report with the findings of increased microclots in COVID-19 patients versus healthy or diabetic patients could reasonably explain the breathlessness, fatigue, and post-exertonial, malaise syndrome, long COVID. Just call it what it is, okay? Don't make me stammer over a word, gosh darn. Moreover, a large-scale cohort UK study based on 48 million adults in England and Wales. If you're looking for large sample sizes, there it is right there. The first week after the coof diagnosis, the risk of arterial blood clots was nearly 22 times higher than someone without the coof. Sorry, what? That is just people who get hit with the coof, okay? According to this study, 22 times more likely to get a clot and 33 times for a venous clot condition. Holy. Okay. So the artery clot is the kind that causes a heart attack or ischemic stroke. Wow, okay, by blocking blood flow to the heart or brain. This led to an estimated 10,500 additional cases of clot-related problems, about 7,200 additional heart attacks or strokes, and 3,500 additional cases of pulmonary embolism, deep vein thrombosis, or other venous problems. Even though the risks dropped sharply to less than 4 times higher than somebody without the COOF in the second week, it remains high 2 times, even up to 49 weeks after the initial diagnosis. This is especially so in regards to the risk of deep vein thrombosis. These are clots that form in large veins. Yeah, don't say that I know about 3 people that this might be hit by, but let's just say I might know 3 people that have been hit by this. Okay, so the spike protein. Okay, first domino that toppled. The blood is a liquid that circulates under pressure through the blood vessels. Thank you, we know about blood. Following a vascular injury, any blood leaking out must rapidly be converted into a gel to fill the hole and minimize further blood loss. That is a big 500,000 foot view on that one, but hey man, it works good enough. Okay, normally the plasma portion of the blood contains a collection of soluble proteins that act together in a series of enzyme activation events that result in the formation of a fibrin clot. This process is protective as it prevents excessive blood loss following injury. Unfortunately, the blood clotting mechanism can also lead to unwanted blood clots inside the blood vessels, pathological thrombosis, heart attack, or stroke, both of which are leading causes of disability and death in the world. COVID-19's way of causing abnormal blood clots has spurned many discussions since early 2020. It appears that the virus's unique spike protein triggers a cascade via many non-traditional pathways. Okay, so as the official, the name of the virus, SARS-CoV-2, enters the cells via a protein receptor called the angiotensin converting enzyme 2, ACE2. Okay, so the ACE2 receptors, you probably heard about those. Okay, endothelial cells express an abundance of ACE2, EC's residue on the inner surface of every blood vessel across the entire body, making them a direct target of the virus infection. Studies showed the spike protein itself can damage the structure and functions of ECs, including impairing the mitochondria and downregulating the protective molecule ACE2 on ECs. All right. Subsequently, the release of cytokines initiate the switch-like molecule E-selectin. Okay, cool. That's weirdly straightforward. On the endothelial cell membrane, allowing them to attach to immune cells, thereby initiating subsequent disease procedures. Additional studies on the spike protein that it activates in EC inflammation depends on integrin alpha 5 beta 1 and NF. I don't know what that is. I know it's not kappa, but maybe it is kappa. Yeah, it would be kappa in the Greek alphabet. Okay, kappa B. Weird. Okay, signaling pathways and subsequent expressions of leukocyte adhesion molecules. That's very technical. Okay, spike proteins trigger the clotting cascade. All right, a number of subsequent events contribute to the clotting cascade. Complement-mediated inflammation of epitheliums, spike protein docking. Weird. Not that type of docking though. If you don't know, you don't know, and if you don't know, don't look any further into it. Okay, ACE2 ECs activate the complementary pathways and coagulation cascade, resulting in systemic endothelialysis, lung injury, and procoagulant state, tendency to develop blood clots. All right, number 2, the complement destroys the endothelium and procoagulant von Willebrand effect. Okay, and F8, are released. Sure. Significant increase of von Willebrand factor, can form multimers that promote thrombosis growth. Medical jargon, love it. Okay, von Willebrand factor, is secretly mainly from endothelial cells, and from A granules of platelets, megakaryocytes derived, that is comparable to the string of beads and strings of a necklace where beads represent platelets. Platelet storm occurs. I'm just going to speed through this. This is just, a whole bunch of stuff that I don't know, you don't know either, okay, because They don't extrapolate on it. It's just a bunch of stuff that happens inside the cell. Okay, this activates this, therefore this activates that. Long and short of it is, this cell gets affected. The ACE2 receptors get flooded, and that clots form. Here's the inner workings of it. Okay, the platelet storm occurs. A whole bunch of platelets show up because you can't just create matter. It's to stack upon one another. Activation of neutrophils lead to the formation of neutrophil extracellular traps, nets, a different type. Okay, EC injury is compounded by a toll-like receptor, TLR. Activation by viral RNA recognition. Spike protein can induce expression of secretion of a series of clotting proteins, which cascade into the clotting process. Sweet. Spike proteins dysregulate the RAA system, which is the angiotensin aldosterone system. All right. Traditionally, people think angiotensin 2 is a neurohormone. Yeah, you get that figured out all the time. That stimulates the constriction of vascular smooth muscle cells and is responsible for salt and water imbalance. However, there's an abundant study supporting the idea that angiotensin 2 is capable of initiating and upregulating inflammatory responses, worsening the clotting state. Ooh, spike proteins directly disrupt the clotting dissolving mechanisms. Oh, wait a minute. So these clots, okay, normally they would just shut off once the injury is resolved. But if it disrupts that mechanism, that's why they continue to build. That makes sense. Okay. Strongly manifested in platelet poor plasma. Don't say that 10 times fast, okay? The individuals of long COVID, the excessive fibrin amyloid microclots can persist. Spike protein 1 was added to healthy PPP. It results in structural damage to beta and I think that's gamma, fibrogen, complement 3, and prothrombone, okay? Hence the results suggests that the presence of spike protein in circulation may contribute to the hyperclotting status and may cause substantial impairment to the clot dissolving process. Microclots block up capillaries and thus limit the passage of red blood cells and hence the oxygen exchange that can actually underpin the majority of these symptoms. Okay, amyloid-like substance is what the spike protein seems to be. Researchers have found that plasma samples from long COVID patients can contain large and anomalous deposits which are resistant to fibrinolysis. Okay, even after treponization, oh lord, okay, after a second treponization, the persistent pellet deposits were solubilized. All right, various inflammatory molecules substantially increased in both the supernatant and trapped in the solubilized pellets deposited of the COOF versus that of controlled samples. Significant abnormal amyloid microclot formation and that are resistant for fibrillosis increased. I'm not reading the rest of that. That is ridiculous. So just a bunch of jargon. Okay, everything happens when the cell is infected. It continues to stack on one another, and then the spike protein looks a lot like other things that are inside your body. Got it good since it's understood. Spike protein inhibits another anti-clot mechanism. Cool. If you want a description of the other one, there it is right there. Feel free to read it on your own time. Spike protein is the smoking gun. There's clinical evidence that suggests SARS-CoV-2 spike protein has been detected in clots retrieved from COVID-19 patients in the acute ischemic stroke and mitochondrial infarction for all of those who care. Based on gene analysis, COVID-19 and post-mRNA vaccine injury have a common molecular mechanism. The altered gene patterns include downregulations of ACE2, ACE ratio, AGTR1, and ITGA5, and upregulation of ACE and F3 tissue factor. Sweet, wonderful, fantastic. So that's just merely the tip of the iceberg, because guess what? We got another one coming through tomorrow. So what did we figure out on that one? So the fibrous clots get built because there's a disruption. There's an injury that occurs inside. Okay, there's something gets severed, and then normally the same coagulants end up just converging on the spot that would normally just patch up the spot until it can normally heal itself. Okay, the injury can get healed by the normal processes, but that ends up getting disrupted thanks to the spike protein, so that those clots just continue to build and build and build and build and build and build and build. Don't know how they stop. Don't know how any of that stuff ultimately ends up getting solved out. And that's why you end up finding, okay, these fibrous clots that just seem to magically show up in all of these patients. It's just very, very interesting, okay? But it's interesting that it's happened in people who have just simply tested positive and people who have also caught, because I'm seeing references here, we might as well read a little bit of this. These unusual blood clots in combination to the thrombocytopenias were reported predominantly in women aged under 60 years old, according to several European countries, restricted to use the adenovirus vaccines in younger age groups. The risk is reasonably systematically analyzed in the international network cohort studies from 5 European countries in the United States, confirming pooled 30% increased risk. Sorry, I've been standing for a long time of thrombro, whatever. After the first dose of the that would be the AstraZeneca and its derivative, the choline AD, I forget what AD is, OX1S, whatever, vaccine, as well as a trend towards an increased risk in venous thrombosis and thrombocytopenia syndrome in the AD, whatever, the Janssen, J&J vaccine? Okay. Compared to the whatever Pfizer BioNTech COVID vaccine. Interesting. So the one that has been studied the most stringently is the one that was pretty predominant across the pond, where this study was conducted in England and Wales. So until tomorrow, that's as much as you're going to get on that one. So with all that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.